Germany is facing a shortage of medical personnel, particularly nurses. According to one estimate, the country will need some 300,000 nurses by 2030, a shortfall it can't make up within its borders, so it's heading outside them to countries like Indonesia and the Philippines. It's led to questions of whether rich countries are literally shopping for nurses in poorer ones at the cost of medical care in these countries. Questions we'll explore in a moment, but first, this report from Indonesia, which has a surplus of nursing graduates, many of whom are unable to find adequate employment in the country. The result, many are heading to greener pastures in Germany.
Learning German isn't easy, but he's totally up for it. Fatur Mahali is one of 284 nurses taking language classes in Jakarta 5 days a week. He's part of the Triple Win program that trains Indonesian nurses for a job in Germany.
I think it offers a work-life balance. In Indonesia, it's more difficult because most of us have long shifts. While in Germany, the respect for nurses is quite high. That's why I want to try and work there.
And of course, because he can earn a lot more money than in an Indonesian nursing home like this one. For a long time, Indonesia couldn't send nurses to work in hospitals and care facilities outside of Asia because there was a shortage at home. But now that it has a surplus of trained nurses, the World Health Organization has given Indonesia the green light for the program.
This is not a brain drain. In fact, we will most likely have a brain gain. Brain gain means once these nurses have gone to work in Germany, they can return home and share their experience and skills with the nursing market in Indonesia.
The money that nurses send back from abroad benefits the local economy, though there are, of course, risks for participants. The acceptance rate for the program is high, but if one fails, a lot of time has been invested in vain. Fatur says he feels the pressure to succeed.
I feel a bit guilty because I quit my job to take part in this program. My family has paid for my college education, and the idea was that I can support myself after graduating. But now that I have signed up for Triple Win, I have no income and rely on my family once again.
There's also the chance that the nurses will like it so much they'll end up staying in Germany. Fatur, for his part, is determined to come back. But first, like the rest of his class, he has to get through the program, and for that, they still have a number of exams ahead.
Like Indonesia, nurses from the Philippines too are leaving to work in countries including Germany. But unlike Indonesia, there isn't a surplus of nurses here. According to one Philippines official, the international recruiting has led to a shortage of around 350,000 nurses in the Philippines. A shortage that was acutely felt during the COVID pandemic, especially when many nurses in private hospitals resigned owing to the heavy workload. Nurses are now being lured by better working conditions, pay and living standards in countries such as Germany, Canada and the United States. And joining me for more context from Manila is journalist JC Katinga. JC, how serious a problem is the shortage of nurses for the Philippines government?
Hi, thanks for having me. Well, it's been serious enough that President Ferdinand Marcos Jr. has brought it up as something that is of serious concern to the country, and he's told the country's health officials to try and fix the gap. According to the health department, the Philippines is short of somewhere between 127,000 to more than 300,000 nurses at the moment, and it might take somewhere around 12 years for the country to churn out, new nurses to fill in that gap.
Despite this gap, the Philippines itself participates in a government-to-government project with Germany, for instance, called the Triple Win Project that recruits nurses for hospitals in Germany. How does the Philippines government square that with the shortage it has in the Philippines?
Well, two things. So number one, it's a constitutional right of Filipinos to be able to leave the country and find gainful employment. So that's been an ongoing argument here in the country, especially during the pandemic when the government imposed like a cap. It limited the number of nurses that the Philippines can send abroad to somewhere like 7,000 to 7,500 nurses per year. Now, there's been proposals to ease that gap, especially from the Department of Migrant Workers, whose concern is to enable Filipinos to find livable work outside of the country, precisely because there's very little work to be found here in the country. And also here in the Philippines, nurses like the healthcare system is such that nurses here who work, for example, for a private institution will only earn somewhere like $250,000 or just $250 to $450 a month if they work for a private institution, somewhere around $600, a little over that, $600 per month if they work for a public institution, which is minuscule compared to what they can earn outside, somewhere around 6,000, 7,000 or thereabouts, $3,000 for entry-level positions.
So what is the government doing to try and address these concerns?
So as I've said, there's now a debate as to whether to maintain that cap, that limit to the number of nurses that the country is able to send out to deploy in a year. The other is it's investing now a lot more in education. A few years ago, the Philippines transitioned to what's called the K-12 systems, which basically meant that for 2 years there were no newly minted nurses coming out of universities and colleges. So, aside from the fact that there's already a great gap to be filled, there was this 2 years when there were no new nurses graduating. So now what the government is doing is putting in investments in education. In the national budget for this year, education has taken the highest priority, which was not the case in years prior. Although that increase in the budget for education does not only cover the education of nurses and other like doctors and other healthcare workers, that is one of the main drivers of this decision. Of course, the country's education secretary is the vice president, the daughter of former President Rodrigo Duterte. So we have to take that into account when asking why there was this huge increase in the budget for education. But right now, there aren't clear-cut answers. The healthcare budget for the country is the third priority in terms of the budget for this year. But advocates for healthcare here in the Philippines are saying that for that to be enough, it has to be at least triple the current amount.
And while these discussions are happening, what is the impact this shortage of nurses is having on patient care in the Philippines?
Well, that was very evident during the pandemic. Our hospitals were swamped. There were patients waiting outside in their cars, reports of patients dying while waiting to be attended to at hospitals. Here and speaking from experience here in the capital, when you go to hospitals, there are very few nurses that are available to tend to the needs of patients. So what ends up happening is there are concerns that the quality of the care that nurses are able to provide will naturally decline because they're just too swamped, too overwhelmed with the number of patients per nurse, the ratios at the hospitals. Now that gets worse the further you go away from the capital. There are places in the Philippines where there's one doctor and hardly any nurse in charge of entire villages and communities.
We'll leave it there for the time being, but thank you so much for joining us on this important story. JC Kutinga from Manila, thanks so much.